Hello.
Hi,
Hello. Hi. How are you?
I'm
Uh,
good. How are
uh,
you?
good. Yeah. So, first and foremost, happy belated birthday. Well, how was the celebration?
Thank you. Unfortunately, this year in Thailand, we are also in the during process of locking down, and
Right.
we really cannot go out to do any big celebration. So we just
Right.
have a little dinner at home.
I see. Hello. Hi, Rongsima. And happy Songkran.
So should I throw the
Yeah.
water to you?
Yeah, we should do one. After this, once everything is done. Yeah. So while you are having a lockdown, the first few weeks you were at the front line, right?
At the front line, means seeing patient,
Yes.
screening the patient. Yeah,
Yes.
in our university hospital, uh, actually at the very first week of the duty about COVID-19 patients was belong to the internists. But after a week, we know that the situation was getting worse, and we have more and more numbers of infected patient or patient who are involved or contact with the infected patients that come to get a screening for. So we, as the other specialty, volunteer ourselves to help the internists to do the screening, also to work on a so-called ARI, active respiratory infection clinic
Right.
also.
I see. So how was it there? What did you see when you were doing that?
So when I was at the it's called EIC, right? Emerging Infectious Clinic. Um, Most of the patients that come for the screening are patients who are kind of worried about that they might get infected by the
Right.
person that they contact with. Uh,
Right.
I was there during the very first week, and for a period that I was there, we saw about 70 cases. And out of
Right.
these 70 cases, I, I think there were only maybe 10 cases who are really suspicious.
Right.
The other 60 are just someone who are too much worry or too much concern
Okay.
about it.
And how many was diagnosed positive under that 10 people that is highly suspicious?
That I don't know, because when they are suspicious, we will send them out to do a swab,
So,
and it will
yeah.
take another 3 to 4 hours to get the result
Right.
back.
And they are doing PCR tests for with the nasal swab, right?
Yeah, yes, they are. But in the other hospital, like Chulalongkorn Hospital, which is
Right.
another big hospital in Thailand, they are doing
Yeah.
the antibody test,
Antibodies, the
which
IgM
which
and IgG.
yeah which you can get a faster result, but you also can get a false negative result for a
Exactly.
person who come in too early.
Yes, exactly. So, today we will be talking mostly about adapting to the new norms, and especially, I'm sure when you're doing the frontliner, were you scared? Were you worried, nervous?
Uh, yes, I am. I think the
Right.
nervous that I have is not only myself,
Yourself,
but I also nervous that if I got the infection, uh,
you,
I may
your
pass
family,
it to my family or pass it
and your loved.
to my patients, my
Right.
general dermatology patients or
Right.
aesthetic patients.
Exactly. And I
Yeah.
think this is something that we will have to worry about for the next weeks or months to come,
Yes.
because we just don't know who we're dealing with. We might not get it from our patients. We might get it from just a simple interaction with friends or someone around, some stranger along the road, right?
Exactly. And this morning, I just wrote a report from PubMed that in New York, they were doing a study in a pregnant woman who come to get delivery at the hospital. and they found that 15% of asymptomatic women who come to get delivery at the one hospital in New York got COVID positive, which is
Oh my
very
God.
dangerous.
Right, exactly.
Asymptomatic women.
Yeah, and we just never know who has it and who doesn't, because
Yes.
this is a silent killer or silent thing that it's getting viral here. And I think this kind of anxiety is gonna be widespread, especially in Asia, because patients might be worried going back to the clinic. Staff will be worried about going back to work. Doctors are all worried. What if we get some of this disease and bring it home to our loved ones? And I think now we have to rethink. And I think today's our main topic will be talking about how we can do all these preventive measures.
Yeah, it is good that you let this point out, because in Asia, I think it differs from the Western culture or Western country, because our family members stay very close or in the same house or in the same compound or area. Even me,
Right.
myself, I haven't seen my mother for almost a month because my
Right.
mother is 80 years old, and I'm too
Right.
scared to if I get infected, I pass it on to an old person. They can easily get worse.
Yes. And I think this is one thing that we are all thinking about. What should we do? How can we be more vigilant and instead of panicking? And I think we have to sort of gear ourselves with knowledge as well as the proper tools to help us to fight this and not to become a vector or spreading the virus itself.
Yeah, exactly.
Yeah.
Because anyhow, it's already happened. And
Yeah.
it's not only us, or not only in Thailand or Malaysia that encounter this problem. It's the world that's encountered the problem. And we will need to learn how to survive and to live with it.
Exactly. And we have more than 2 million people diagnosed of this right now. And these are people who actually got tested. And we have so many people that is not being tested. So I think the numbers will be huge.
Yeah, I think another thing that it worry you and worry me, or even the other doctors or person who travel is, I am so worried that I am so afraid to travel during this first of the first half of the year or during the
Right.
next 6 months, because as long as the situation cannot be controlled, it is very difficult to control ourselves.
Yeah. And I think if anybody has any questions or anything that you want to just throw it out, we will talk about it as much as possible. And one thing that you truly pointed out, ignorance is the bliss. And before this, when we were traveling, we are always traveling with our bags, with our luggage, pulling around all these shitholes places. We walk around, and then we go and shop a little bit, and then we go on the plane. The first thing we sit down is we get a drink and some nuts to eat. And then right after, we didn't even wash our hands, just dig our hands into the nuts and just put into our mouth.
Exactly. And then when you got off from the plane and make friends, you hug them, you kisses them.
Exactly. we are the worst vectors in the world. We are worse than mosquitoes.
Yeah, right.
And I think these are things, the risks that we never thought about. Imagine if you go shopping, you had your hand on the handrail, you go and buy a beautiful handbag, and then you touch on the handbag, you bring it home, you show it to your friends, you show it to your family, and then you start to hug your family. And these are things that we never thought about.
Yeah, and another thing is, last week I just talked to Langsima, for ladies who love to wear this
accessory.
Yeah, accessory on the hand, or even watches or Hermes bag that you carry around. This is all of the carrier that
exactly. And we later on will talk a lot about our practice, how we want to do to protect our patients our staff and ourselves. But thinking outside the box, we have a very nice system inside our practice, but all of us still function outside of a practice. Imagine right after we do everything very, very thoroughly, but the next thing we go to is a hair salon. We get a haircut, and our hairdresser has been using the same scissors or trimmer since morning. They probably pass through 50 to 60 person before getting to us. It might have lots of droplets from another 30 over people that walks and talks around it. And these are things that can pass to us. We might just touch maybe on our shoulder or our cap or our hair or our glasses. And then the first thing you go home is you take it down and you start touching around and you start to spread it or touch our hands, eyes and mouth. So the risk is all out there.
Yes,
so that's
exactly.
a lot of things that we have to take into account from now on.
It's difficult, but at least we will have to try our best to prevent ourselves from getting infected until hopefully that the vaccine of COVID-19 will come out, which I believe it will need another year at least to get a safe and effective vaccine.
Yeah, and one thing that I think we need to do as doctors is to start educate. I think by instilling a lot of fear, I think a lot of people go into the panic mode. There's nothing you can do when you panic. You couldn't get anything out of it. In fact, you might as well just stay at home and do nothing. But I think this is not functional. So I think by instilling good knowledge about how to prevent, how to sort of be more vigilant in terms of our own health, as well as try to see what are protocols that we can sort of go on and do. And even beyond our practice, early this morning, I got a call from a friend who is working with lots of beauty salons and hairstylists. And the first thing that he asked me is, can I give them some suggestions? What are the standard operating protocols or procedures that they can apply to all beauty salons and hairdressers, hair salons right now? So these kind of things will not just confine to our own medical practices, but can also apply to all the practices out there.
Yeah, I agree with you.
Yeah. So what are the bare minimal do you think that any practice should have?
Are you talking about medical practice?
Yeah, let's say about medical practice first.
I think there are at least 3 or 4 things that we will need to manage and to measure. Starting off how to manage, how to educate the patient before they coming in to our clinic, and even in the waiting area or in the lobby area, or like after they leave the clinic, we will need to educate the patients. Secondly, you will need to do the prevention measurements for your staff, both the medical staff, nurses, or the staff or non-medical professional staff that working in your clinic. And lastly, not only human, you will need to also do the preventive measures for all the equipment, the bed, the table, or the room that you will need to spend time with. I think this is at least 3 things that you will need to be very careful.
Exactly, and I think you say good thing. I think one thing you pointed out is education, getting how to protect, how to do. I think face mask is important. Always keep their hands sanitized in certain ways. And you say about sanitizing the area, keep areas that you don't need. We mentioned yesterday about not having books lying around or toys or things that they can play with. That could be a contagion. Yeah.
Right.
Maybe having all their handbags wrapped up.
Don't carry too many things into the clinic.
Right. Exactly.
And
what about?
Sorry, one thing that I like to point out is it good that you put a sign on the at the entrance or in the waiting area, educate your patient and letting your patient know that this is the measures that you intend to do to protect themselves or protect the country. Otherwise, some patient may get angry that you are doing too much. You are too much concerned about this.
Exactly. I think it takes some time to do all this education, and I think it's not just one or two men's job. I think the more people get involved in spreading the knowledge and also educate each other in terms of what is the best way to be vigilant for all of us, I think that's important. And you talk about sanitizing the place. What would you recommend? Let's say even they can do at home, or if you want to do in practices like clinic.
Actually, you can go into the CDC or WHO website, and they are recommended some disinfectant solution that you can use to disinfect this COVID-19 virus. But there are another light disinfection, which is ultraviolet C, that getting more and more attention. But actually, when I did a research last week looking into the efficacy of UVC to kill the SARS-CoV-2 virus, actually there is no evidence saying that UVC can really kill this particular type of virus. But according to SARS that happened in 2003, UVC are effective resource that can kill that particular type of virus. But we assume that as long as they are in the same family of coronavirus, UVC may be able to kill it.
Yeah, and there's someone asking what can you suggest, what procedures can you still be done in clinics?
A very difficult question. But if we talk about the aesthetic dermatology or aesthetic medicine clinic, there are some procedures that are at least of getting infection spread around. Like if we were to do any ablative laser procedure that create a lot of smoke, or even the laser for hair removal, that when you shoot to the hair shaft, it can produce the plume. Or even the electrocautery or desiccation, that can also produce the plume. Because actually, we know that the COVID-19 virus can be found in the droplet. But there have been a lot of reports that this particular kind of virus also can be found in serum or in plasma of infected patients, or even in the salivary gland. That's why the dentists are very scared about this.
Exactly, and I think one thing that I mean, if you want to be 100% safe, I mean, do nothing. But the problem is we cannot do nothing forever. So I think
we cannot survive by doing nothing.
Exactly. So I think that's why today's topic will be talking about what I think a lot of procedures can be done under very strict supervision and vigilance in terms of protecting ourselves and our patients and our staff.
Yes, and, exactly. Yeah. If you want to perform the procedure, I think you will need to protect yourself very well. The reason is you don't want to get infected and pass it on to the other patients. This is the point.
And I think the best, the things that I think is very essential for me is face mask. Also had a little bit of facial.
Right. I think in the operative room or in the procedure room, we will need to wear the so-called PPE, the protective gear to protect ourselves very well. The face mask, yes, of course, is one of the important instrument. But according to the CDC or WHO, you will need to wear the N95 mask or the so-called FFP2 respirator, which
Right.
I believe if you were to do a very time-consuming procedure, it will be very difficult for an operator to breathe through this type of mask.
Exactly, and it's horrible. The N95, it's so tight that you couldn't even do your work not for even longer than an hour. So I think
yeah,
you
go
say.
ahead.
So I think for any practice, at least I think a surgical face mask is important. Unless, like you say, it's a big operation and you do play with a lot of fumes and plumes that you definitely have more exposures. I think then you might need a good mask to protect yourself and everybody else. But then again, I think having the room cleaned out right after is very important as well.
Okay, you mentioned about surgical mask, but for me, I think surgical mask is still not safe enough. There is a special mask that we call laser-proof mask. I'm not sure you can see it. It's in the purple color. And this particular thing can filter out any particle which is bigger than 0.1 micron, which is as big as the size of the virus.
Right. It's similar to FFP mask, right?
No, the FFP is a respirator that they have the valve on.
Right.
But this particular mask, basically, it looked like the
normal surgical mask.
The normal surgical mask, but it made from a bit different material that can filter out a much smaller particle.
Yeah.
And not only
you think
not only wearing the mask. If you were to do a procedure that come out with a lot of plume or smoke, you will need to have a very good evacuator.
Exactly.
Smoke evacuator that you will need to hold the nozzle as close as 1 inch to the origin of the smoke, so that once the smoke come out, it will be sucked into the evacuator, not spread inside the room.
Yeah, exactly. And I think one of the things that commonly used or commonly done in our practices is they always have a blanket and pillow in the room. And these are all places that you can have lots of issues with. And I think from now on, if you have blankets, even beauty salons, blanket has to go away. You have to do something that you can change after every single patient that comes in and go out. And also your bed sheet needs to be changed every time, including your pillow as well. Mm-hmm. So someone asked about how about clothing and scrubs? Yeah, I think that is
this is another point that I would like to emphasize, that you will need to wear at least a disposable gown that you can take it out and change the new one when you see the new patients. Otherwise, this is another carrier that can carry the virus and pass it on to the next patient.
Exactly. But the thing is, not a lot of practice. It's not very cost effective for a practice to have a daily gown. If you see 20 to 30 patients a day, and you have maybe 10 or 20 staff in your practice, and then if they see so many, I think you'll probably be a big consumer of all this. I think, but one thing that I think we should do bare minimal is always make sure that you wash your hands and keep a distance, keep your patients in a way that they are not even exposed. And the other thing that we really need to be vigilant about is to make sure that all our patients after the contact, they always have to have their certain ways of taking things out, washing it away. And never wear the same clothes that you are working and bring it home to your loved ones. And I think that is something that we have to take into very seriously.
Mm-hmm. Mm-hmm. How much does it cost for a gown to change the new disposable gown?
The gowns, I think it's not that expensive, but if the numbers become big, I think that will become
I think you can easily add it to the patient. I think if I were the patient, I am willing to pay for the new cloud. I don't want to get
Right,
infected.
That's true. So someone was asking, does it safe to do pico toning? What kind of APD I have to wear?
I think if you do a very well screening of the patient before they getting into your clinic, it is safe to do it, but you will need to protect yourself very well with all of the equipment that I mentioned. And another thing that I would like to suggest is to protect the staff or ourselves during the patient lying down on the couch for doing the procedure. You may need to have the patient wear the mask as well, but you will need to have them take up if they have something to do to have you treat under the mask.
Yeah, I do agree that everybody who walks into the practice needs to have a mask on, unless we need it to take photos or do treatments. And talking back to PPEs, I think there was we were looking into PPEs for every single treatments. It is quite expensive to do so, but like you say, and in certain ways you can actually do certain protective measures, especially if there's something that you can actually the cheaper disposable ones are something that we can look into. And one more thing is that we talk about trying to sort of clean up the area as much as possible. Any other things that you will be more you'll be concerned about in terms of making sure that all our staff is making sure that they are safe and they are not carriers? Do you do testing for them, or what would you suggest?
I think we don't need to do the general testing for them as long as they do not travel to anywhere. And what we do is, what we recommend is, we will need to do the body temperature measure for our staff at least twice a day, so that we can make sure that during the time that they are working, they don't have any suspicious symptom that they can be another carrier. And,
exactly.
and again, we will need to tell our staff to have their hand rub with alcohol-based hand rub or with soap and water periodically, very often during their working hour.
Exactly. And one thing is, I think the workforce, we talked about it yesterday as well, that to be able to function in a more what we call a safer way, we might need to split our manpower to two.
At least two. If you have enough, you can split it into three.
Right.
Because if one of the member in one group got infected, they will need to be quarantined for the whole group for 2 weeks, so that the other group who's still normal can work during their quarantine period.
Exactly. And I think that is something that is important. It's already practiced by a lot of companies, big companies, where they have their workforce. Each department is divided into three, and then they make sure that if one is down, two others or one more others function, so it doesn't disrupt the whole operation. And I think that as one thing that is a lot more challenging for small enterprises, small clinics to do so. But I think for more sustainable way of operation, that is something that you can consider or something to put into mind.
Yeah, one thing that I forgot to point out is the hair thing. You also will need to cover your hair. So if you're wearing the gown that doesn't have any hair cover, you will need to wear the other type of hair cover, because this is another thing that you can get in touch with the virus.
Exactly, and I think wear something as simple as possible. Like we used to mention about white coats being something that is as germ spreading.
Or necktie.
Yeah. And sometimes all the accessories, like you should talk about your watches, your necklace, and all this accessories on your hands would be another great ways of spreading all these kind of germs as well.
Okay, there are 2 or 3 more things in terms of patient preventive measure that I like to mention. Number 1 is the characters of aesthetic patient. They always come in with friends or with relatives, just to make sure that they are making the right decision. But during this pandemic, I think we will need to tell the patient to come in by themselves or with a very minimum visitor that are not the patient. Otherwise, this is another source of spreading.
Right. And I think a lot of people look into this because this is the first time ever that so many countries go into lockdown or semi-lockdown or movement control or so-called circuit breakers. But a lot of people think that this is only until that is over. But the real reality is this is far from over. Even after everything is released, I think this will drag on for how long? How long do you think that this will last?
I really don't know, and I don't think that anybody know. But over, in your sense, it's not only over within the country, because we are globally connected. You can finish the job in your country, but once you allow the other person from the other country coming in, they become another spreader.
Exactly, and this is something that we are worried about because this will definitely be something that will drag on for months. And I think our best practice will have to continue on, and it has to become, some of it will become our new normalcy, our normal practice from now on. So a lot of things that we have to look into is also sustainability in terms of, let's say, if you want to apply this kind of practice we have to consider it to be practiced for the next few years to come.
Maybe the future practice behavior.
Yes, exactly. And I think it's not so much of short-term planning, it's a long-term planning. And I think that has to be taken into account.
Yeah.
Right. Yeah.
And I think another way that we may have to change in order to minimize the spreading is doing more and more online consultation or online visit, especially for the first consultation. You can shorten the period that we staying face to face by doing the first time online consultation, talking with the patient, knowing each other and tuning the environment to each other before they really coming into the clinic and sitting face to face with you. And also,
yeah, I think that's a great idea. Yeah.
And also the follow-up after treatment. Most of the time, the patient actually don't need to come see the doctor face to face. But what we would like to know at the follow-up period is knowing that they are doing okay, they are doing as good as they should be. By doing so, we don't need to be physically sitting face to face for the patient. We can see the patient online, or they can even take a close-up photo by their mobile phone and send to us. And this is the way that we should plan ahead and do it.
Right. And how do you think that this virtual consultation will gain acceptance in the months or years to come? Do you think it will become more routine?
I have a feeling so. I just talked to Langsima this morning that we should have a setup that doing this kind of online consultation or online follow-up for the patient. And first, I think she kind of doesn't agree with me. but after I explained her about this prevention measure, I think she buy in.
Okay. I think definitely something that is really, really interesting right now is this will really expedite the whole e-consultation or online consultation that we started to see. But I know it might take some time for people to be comfortable doing this online consultation, but I think it is the way to move forward, and it's already practiced in certain part of the world and has gained some traction. But in Asia, generally, I think the sentiment is unless it's necessary, they won't do it. But thanks to COVID-19, we might see this changing.
Yes, but if you think about the positive thing,
Right.
in medicine, in very most of the field in clinical in clinical part, you will need to do a very good physical examination. When we were taught in medical school that you will need to undress the patient and do the
Right.
whole body examination from head to toe. For
Right.
the other part of medicine, they will need to contact with the patient, I think more than dermatologist. For
Right.
dermatologist, for aesthetic, you mostly on the first time, you can just point into the part or the anatomy area that the patient concerned.
Exactly. As long as they move their face, as long as a video or a way that we can see how the animation is. Plus, on top of that, I think a big chunk of it comes from history taking and to interaction with our patients. And I think for this part of medicine, yes, virtual consultation is very, very feasible.
Mm-hmm. I think, would you like to answer some of the questions because we are running out of time? We have only 1
Exactly.
hour, right?
Yeah. So I think there's any more questions from
There is one doctor from Germany, Stefan, saying that they still see patient in doctors still see patient in person.
right? I mean, right now,
Right now.
during now. Oh, okay.
Mhm.
I think well, we won't want to judge, but I think for practices that feels that it's safer not to see patients, I think for non-essential ones, I think that is something that we really. But of course, there are patients or there are certain circumstances that you actually need to see your patients, and I think it's up to a judgment of the doctors whether this is a good time. If it's not unnecessary, I think perhaps if you're not in the area that is highly with a lot of suspected cases, because even now I know Korea and Taiwan, they are still seeing patients.
Mhm.
And the numbers are still under control. So I think that is something that's ongoing. But of course, like country like us, where we are still worrying about the surge of numbers of people getting infected, perhaps this is not the best time to do so.
I do have one of my ex-resident who
Right,
is now working in a big hospital, infectious disease hospital. Uh,
right.
Her name is Ik. Ik, after listening to our conversation, do you agree with us, or what kind of PPE that do you wear while you seeing the patient at your hospital? Okay. While we waiting for the answer, you can continue talking.
Right. Well, so talking about PPEs, because I think there are some questions from doctors here. They might be dermatologists, they might not, they might be doing aesthetic practice as well. Is that after the lockdown, is it a necessity to wear all full gown PPEs? Because we know a full PPEs is not cheap and it's very uncomfortable to wear for the whole day. And it's impractical to wear it the whole day with the same PPE either. So that means after every single patient that you see, does it mean that you want to change it to protect your patients, or do you wear it just to protect yourself so you don't actually bring it back home? So this is one of the things. What do you think?
Okay. What do you mean by the actual PPE, the one that coming with a hood, right?
Full gowns with all protection up to so you
I
can
think
zip yourself.
if you would like to be very well equipped or well protected, you will need to do that. You will need to wear the complete set of PPE and change when you see the new patient. This is very well protected. But like I mentioned at the very first minute in our conversation, the reason why we come out with this strategy not to protect ourselves from getting infected, but we also will need to be very care of all of the single patient that coming into our clinic. We don't want to pass the germ from the previous patient to the new patient that just walking in. So by doing so, you cannot wear the same PPE seeing the patient for the whole day. This is for the fairness of every single patient.
Exactly. So I totally agree. And a lot of doctors have been really worried about wanting to wear PPE or not wear PPE. I think the first thing is to think about what is more sustainable, because like what Professor Woraphong mentioned earlier, is no point that you have PPE but wear it for the whole day. Yes, it will protect you, but it doesn't mean that it will protect your customers or your patients. So I think something more feasible is something, if you have a gown that you can change, that's one. If not, just be very vigilant in terms of hand washing, clearing things, and make sure that when your patients is being treated or going through treatments, we are always have very mindful in terms of making sure that there's no, we have to reduce the risk of spreading to them and them spreading to us.
Okay, I have an answer from Ik, which is my ex-resident who working in the infectious control hospital. She said she wear mask with face shield when she's seeing the patient who are not COVID positive. But whenever she see patient with COVID positive, she will wear the full PPE with N95.
Exactly. So I think that's good, because face shield does a lot of work in terms of preventing droplets from spreading out and droplets from coming in. And I think we, in a way that we are blessed, because we don't see patients who are high risk of getting COVID-19. Probably the chance of one person with possible COVID-19 coming in is very, very low.
Hold on. I don't agree with you in this issue that we are lucky that and we are not seeing the patient who are at risk of getting COVID-19. I would like to remind you to the finding that just report yesterday that in pregnant women, 15% of pregnant women have COVID positive. You can imagine that pregnant women are very careful about themselves, that they won't want to get infected, but still 15% of them.
Yeah, but that's very true. You can never say never, and you can never say, like, we will think that the numbers will be very low, the risk very, very low, but at the same time, there are chances of getting it. What I'm actually implying is that the chances of getting it is not as high as perhaps from ID clinic, but at the same time, we still need to do the bare minimum to protect. And I think what we really want to come out with is something that we have to do to protect ourselves, our staff, and also our patients, and something that we can all apply throughout all the practices around this region.
Okay, there is another suggestion from Ik about the use of N95, because we have very low supply of N95 for the moment, and we will need to reuse it. But please make sure that you keep the use N95 properly. because the outside of the mask can be contaminated, and you will
Exactly.
need to make sure that you change the glove and put the new glove in.
Right, right, exactly. I think changing gloves is important. Face mask, if your facial shield, if you want to be careful each time after you seeing patients, you change a new one, or you can actually do somewhat of a sanitization before you go and see another patient. And I think somewhat of a protective gown is important. I think those are things that we really have to put. And I think sanitization is important.
And
Anything else?
another
Yeah.
thing that Ik point out is she's been seeing more and more COVID positive patients who come out with drug allergy, because once they are hospitalized, we try so many medication on them, and some kind
Right.
of cocktail may create some allergic reaction, and
Right.
we may see more and more patients, COVID positive patients who come with drug rash.
Right. So I think those are things that, we have to take into account. So basically, be vigilant is very important. Always, like you say, if 50% of people come in for all this a delivery that they have COVID, they are possible having COVID, you just never know, because you might be in the hot spot and the red spot, and you just never know about it. And I think the thing that we should practice from now on is more on the universal precautions. Just
Exactly. Yeah.
always treat as if we have it, our staff has it, or our patient has it. So always think that way, and we should be able to sort of fight this in a better way.
Mm-hmm.
I think today we did a very long one.
Yeah, very long. Oh, one last thing, if I may.
Yeah.
According to the recommendation of CDC and WHO, when we screen the patient, even the patient have the low-grade fever. The low-grade fever, in the sense, is the definition of the temperature above 37.3. You need to screen them out, because sometimes this group of the patient have a risk of getting pre-symptomatic infected.
Yeah, so screening is important. Yesterday, we asked about the screening done in Taiwan. Basically, anybody who has a travel history in the past 14 days, generally they are considered screened out. So they should be not seeing you if they have any history of traveling.
Oh,
so
that is another interesting, maybe the last issue. It say that she been seeing patients who are positive for PCR.
Right.
That means they may get another infection. So please be very careful.
Yeah, so the reactivation that we discussed about yesterday as well is something that is interesting, because if you consider that, then that means even if you are vaccinated, then it doesn't mean that you are 100% safe. You might be a carrier. You might not have as bad as symptoms, but doesn't mean you are not a carrier. That's one thing. And the other thing is, even if you are protected, how much protection are you getting out of this vaccine is a big question for all of us.
Right.
Thank you so much. I think we had a lot of talks today.
Thank you. Yeah.
And, so I think this will drag on for some time. We will have more and more talks about this in different webinars, as well as different live sessions in weeks to come.
Yeah, if anyone who are listening to our discussion now, we did a video clip about the lecture of how to do preventive measure in our clinic. My lecture talking about how to be very well equipped and protective. Some of you may not agree with me, but the intention is to be very well protected so that we are safe and our patients are safe.
Exactly. Thank you so much, and it's a pleasure always to have all this kind of discussion. It's always mind stimulating.
Thank you. Okay. So I will end up with the Thai culture. สวัสดีครับ
สวัสดีครับ
no shake hand, no hug.
สิ่ง
Bye
ไม่ค่อย
bye.
เลย
Good night.
Bye.